All right, ready to dive into something kind of personal. We're talking polycystic kidney disease.
PKD.
Yeah, PKD. Might be new to some, maybe familiar to others. We'll break it down, how it's spotted, what you can do.
But the big question, right? Can you really live a full life with PKD?
That's what we're here to figure out.
And the answer is yes, absolutely.
Okay, good to hear, but how? Start us off, what exactly is PKD?
So it's genetic, a disorder. Basically, you get these clusters of cysts. They're fluid-filled, and they grow right in your kidneys.
Cysts like,
Imagine tiny balloons expanding inside your kidneys. Problem is, that messes with how they work, filtering waste, keeping your blood pressure in check, all that.
so not just a little plumbing issue, these cysts sound like real trouble.
They can be. Lead to high blood pressure, kidney stones, even kidney failure if it gets bad enough. That's why catching it early is so huge.
Makes sense. The sooner you know, the sooner you can, fight back?
Or like manage it. We can't undo the cysts, but we can slow things down, handle the symptoms, make life livable.
So it's about the whole body, not just the kidneys themselves.
Exactly. Now, there are two main types of PKD. Most common is autosomal dominant, ADPKD. This one usually pops up later in life, adulthood.
From what I've read, it's just one messed up gene passed down from a parent.
Yep, one parent has it, 50-50 chance their kid inherits it.
Okay, so if you got the healthy gene from the other parent, no worries.
Not that simple, unfortunately. ADPKD, that one dominant gene, kind of overpowers the healthy one.
Huh, interesting. And the other type?
Autosomal recessive, ARPKD. Much rarer, needs both parents to carry the gene. This one can be rough, often shows up at birth or really young.
I'm guessing that autosomal thing, that's the genetics part.
Right on. Means it's not the sex chromosome, so it doesn't matter if you're male or female, equal chance.
Okay, that makes sense. So let's say someone's worried, maybe family history or some symptoms they're just not sure about. What's step one?
Doctor, ASAP. They can order tests, imaging, like ultrasound or CT scan, actually see the cysts in there.
So not just guessing based on how you feel, they can really see it.
Oh, yeah. And blood and urine tests, too. Check how well those kidneys are doing their job.
Got it. So early detection, that's the name of the game.
Couldn't stress that enough. The earlier, the better. For managing symptoms, protecting those kidneys, all of it.
All right, so let's talk managing it. What can someone DO to slow this thing down?
Honestly, a lot of it's stuff we should all be doing anyway. Blood pressure under control, low sodium diet, drink plenty of water, no smoking, easy on the alcohol.
The healthy living basics, but even more important with PKD.
Exactly. Now, on top of that, there are meds that can help. Tolvaptan, for example, targets a protein linked to those cysts, slows their growth for some folks with ADPKD.
That sounds promising. But I bet there are downsides too, right? Side effects.
You bet. Tolvaptan, it can mess with your liver, so not for everyone. Got to work closely with a nephrologist, kidney specialist. They'll weigh the pros and cons.
Okay, so we've got lifestyle changes, meds, specialists on board. What about those everyday aches and pains? Those got to be tough.
Over-the-counter pain relievers can help. Important thing, though, avoid NSAIDs, like ibuprofen. Those can be hard on the kidneys.
More reason to stay in close contact with your doc.
Absolutely. Communication is key, patient to doctor, and paying attention to your own body's signals.
So, no magic cure yet, but there's a lot we can do to manage PKD.
Tons. And that's just scratching the surface. We'll get into more specifics next time. ADTKD versus ARPKD, the exciting research happening, the whole 9 yards.
Sounds like there's a lot to be hopeful about.
Oh, yeah. But before we go, what's stuck with you so far? What's standing out?
I think it's how proactive you got to be. It's not giving in, it's taking charge, learning to live well with this thing.
Couldn't agree more. And the genetics angle, it really makes you think. Conversations with family, maybe even planning a family, all those choices.
That's a good point to ponder. So listeners, think on that as we head into part 2. Back soon to unpack even more about PKD. Back again, ready to dig deeper into those two PKD types.
ADPKD and ARPKD.
Right. We talked about the names, how they kind of tell the story.
They do.
Autosomal, not the sex chromosomes, so men, women, same deal.
Exactly.
But that dominant versus recessive, that's got to be key, right?
Oh, absolutely key. With ADPKD, dominant means one copy of that bad gene is all it takes.
So from one parent, and boom, you've got it.
Yep. Even if your other gene from your other parent is perfectly normal, that dominant one, it's calling the shots.
No matter what, huh? Interesting how that works.
Genetics are wild, man. Now, ARPKD, recessive, totally different story.
Both parents got to be carrying the bad gene.
You got it. It's like both copies of the gene need to be wonky for the disease to show up.
So statistically, way less likely to happen.
Which is why ARPKD is so much rarer, thankfully.
Okay, so that's the inheritance part. But what about, like, how it actually affects people?
Good question. Symptoms, severity, all that.
We know cysts are involved in both, but is the timeline different?
Big time. ADPKD, it's usually adulthood, 30s, 40s, sometimes even later.
Like, you could go years without knowing.
Happens all the time. Maybe some high blood pressure, a bit of back pain, nothing too crazy.
And then, bam, you get scanned, and there they are.
Sneaky, right. That's why regular checkups are crucial, especially if it runs in the family.
But ARPKD, that one hits right away.
Yeah, often present at birth and a lot more severe, sadly.
So babies born with it, what are they facing?
Well, their kidneys can be huge real problem for breathing, even feeding. Sometimes other organs are affected too, liver especially.
That's going to be tough for everyone involved.
It is. With ARPKD, you need a whole team of specialists right off the bat.
Because it's life-threatening right away.
You got it. Breathing problems, feeding issues, those take priority. They use meds too for blood pressure, kidney function, but it's intense right from day one.
Okay, so managing each type is totally different.
For sure. ADPKD, it's about slowing things down, controlling those symptoms we talked about, preventing the worst case stuff down the line.
Lifestyle changes.
Yeah.
And maybe tolvaptan if it's appropriate.
Yep. But gotta watch out for those side effects, liver especially. That's why that close relationship with your doctor is so important.
And ARPKD, more about handling the immediate crisis, I guess.
Yeah, sadly, some babies don't make it past those first few months. But if they do, the focus shifts to managing those long-term effects, the damage that's already there.
Man, this is heavy stuff. I think it's important to remember, even within each type, it's not the same for everyone.
Absolutely. Right? Every case is different. It's not just about the diagnosis, it's about the individual person, how it hits them.
So if someone's listening and they're thinking, uh-oh, this sounds familiar, what should they do?
First thing, talk to a doctor, tell them everything, family history, symptoms, anxieties, the whole 9 yards.
And if they get that PKD diagnosis?
Deep breaths. It's a lot to take in, but knowledge is power. Once you know, you can learn about your type of PKD, the options, and most importantly, connect with others who get it.
Find that community.
Huge. Support groups, online forums, there are organizations doing amazing work, research, advocacy.
So you're not in this alone?
Never. Now, we've talked about diagnosis, management, but there's also genetic testing. How does that fit into all this?
Yeah, I'm curious about that too.
Testing can be super valuable, especially if PKD is in your family, confirms the diagnosis, tells you which type, even helps with family planning.
So implications beyond just the individual, huh?
For sure. Couples wanting kids, knowing PKD's in the picture, they can get genetic counseling, make informed decisions.
Sounds like it could help prevent a lot of heartache down the line.
That's the goal, empowering people with knowledge. And from a research standpoint, genetic testing is a goldmine.
How so?
Well, analyzing all that genetic data, they're finding new genes linked to PKD, figuring out how to target them for treatment.
So not just understanding the cause, but tailoring treatments to each person.
Exactly. That's the future of medicine, really, and PKD is no different. A lot of exciting progress happening.
This is all great to hear, but we'd be remiss if we didn't talk about the mental and emotional side of things.
Oh, for sure. PKD, it's a tough diagnosis. It's okay to be scared, anxious, uncertain.
Especially with all those potential complications looming.
And the way it impacts your life, your family, everything.
So for someone struggling with that burden, any advice?
First off, don't go it alone. Talk to people, family, friends, a therapist. Join a support group.
Sharing the load? That makes a difference.
Huge difference. And taking care of your mental health, that's just as important as the physical stuff.
Finding that balance, right?
Mm-hmm.
Fighting the disease, but also taking care of yourself.
Exactly. And remember, there are resources out there to help with both sides of it. Don't be afraid to reach out.
We've covered a lot, the types of PKD, how it's passed down, the impact it has, how to manage it.
And the role of genetics, both for individuals and for pushing research forward.
And we're not done yet.
Nope. Next time, we'll dive into the cutting edge, the latest research, new treatments on the horizon, all that good stuff. We'll also give some practical tips, resources for living with PKD.
Sounds like we've got a lot to look forward to. Stick with us for the final part of our deep dive where we'll wrap it all up. Okay, so we've talked about the challenges, the types of PKD, how it's managed, but now for the good stuff, right? The future of all this.
The future's bright, that's for sure. PKD research, it's really moving fast these days. Lots of exciting stuff happening.
Give us the highlights. What's got you pumped?
Well, one word, Gene therapy. It's cutting edge, but the potential, wow.
Gene therapy, that's where they're trying to, like, fix the genes themselves.
Exactly. Instead of just dealing with the symptoms, what if we could correct those faulty genes causing the whole problem in the first place?
Sounds kind of sci-fi, but amazing if it works.
It is sci-fi, kinda. There are a few different ways they're tackling it. Some researchers are trying to silence the mutated gene, others are trying to deliver a healthy copy to take over.
But it's going to be super complicated, right? Getting those gene therapies right where they need to be.
Oh, huge challenges. Targeting the kidneys specifically, making sure it lasts, long-term effectiveness, all that. But if they crack it, man, it could change everything for people with PKD.
Definitely something to keep our eyes on. What else is cooking in the research world?
New meds, that's another big one. We talked about tolvaptan, how it slows cyst growth. But imagine if we could stop it completely.
That would be, what, a cure?
Potentially, yeah. Scientists are getting really good at mapping out how those cysts form, the molecular level. They're finding the proteins, the signals, the whole chain reaction that makes those cysts grow.
So like cutting off the fuel supply.
Exactly. And there are drugs in development, some already in clinical trials, that can interfere with those processes. Early days, but the results so far, very promising.
Wow, so it's not just slowing it down, it's stopping it altogether.
That's the goal. And these new drugs, they're way more targeted, more effective than what we have now. Fewer side effects, too, hopefully.
Man, it sounds like there's a lot to be optimistic about.
Yeah,
In a few years, who knows what kind of treatments we'll have.
I know, right? It's a good time to have PKD, in a weird way, because things are moving so fast. And it's not just about new drugs and gene therapy,
What else?
personalized medicine that's getting huge. The idea is to move away from that one-size-fits-all approach.
So not everyone gets the same treatment. It's more tailored.
Totally. Using genetic testing, biomarkers, they can figure out which treatments will work best for each person based on their genes or specific situation.
Makes a lot of sense. Maximize the good, minimize the bad.
Right. It's like taking all this knowledge we're gaining about PKD and applying it on an individual level. Super powerful stuff.
This is all fantastic news. Really feels like there's a lot to look forward to in the PKD world.
Absolutely. But one thing I always emphasize, we can't just sit around and wait for these breakthroughs. We need to be active, be advocates.
Do you think about patients, families, getting involved?
Everyone. We have a voice. We can push research forward, raise awareness, fight for policies that support PKD, the whole 9 yards.
Okay, so if someone's listening, feeling inspired, what can they actually do?
First off, connect with organizations doing the work. The PKD Foundation, for example, they're amazing. Resources, research, advocacy, they do it all.
So find your tribe, lend your voice, your support.
Exactly. Another big one, participate in clinical trials if you can. That's how they test new treatments. Make sure they're safe, effective. Need volunteers for that.
What if someone can't do a trial, for whatever reason?
No problem. Donate if you can. Even a little bit helps. Lots of these organizations rely on donations to fund their research.
And just talking about it, raising awareness, that's got to help too, right?
Huge help. Share your story, educate people, be a voice for the PKD community. It all adds up, moves us closer to that cure.
So many ways to make a difference, big or small. Feels good to know that.
It does, it does. And that's why I'm optimistic. It's tough. But with the research, the advocates, the community, we're going to beat this thing.
I like that attitude.
Oh, yeah.
Got to have hope, right? Well, this has been an incredible deep dive. Thanks for sharing all this with us.
My pleasure. And to everyone listening, I hope you learned something, maybe feel a little more empowered. Knowledge is power. Even when things are tough, never forget that.
Couldn't have said it better myself. Keep exploring this topic. Connect with others. Be your own best advocate. And remember, you're not alone in this.
Lots of people out there walking the same path, ready to support each other.
Thanks for diving deep with us. Stay curious, stay informed, and most importantly, stay well.